Welcome back. We have Dr. Preety Desai joining us on the show again today. It's great to have you back.
Pleasure.
Yeah, it's great to have you. We're talking today about a subject that is quite relevant. People who undergo cancer therapy, so many different side effects. One that not everyone might think about is the effects that it can have on your mouth, your oral hygiene.
And it's actually more recently being diagnosed because there's so many ranges of severity, from almost nothing to some patients having quite a painful experience.
Does it depend on what kind of treatment or just your genetic makeup as who you are?
I think a little bit of everything.
Yeah.
Whether you're having radiation therapy, chemotherapy, a combination, and what type of cancer is being treated as well, right? So often people start with the radiation therapy to shrink things down, and if that cancer is in the head and neck area, obviously is your salivary glands, vital structures, that'll be more affected.
Sure. Okay, so we have some pictures. They're a little bit graphic, but nothing we can't handle, Dr. Desai. What's going on here?
This is oral mucositis located to the tongue right now, and mucositis means inflammation of the tissues.
Okay.
And this is one of the major side effects of both radiation and chemotherapy, that the tissues become very tender and friable because the high-producing cells we're trying to kill with cancer, but one of the high-producing cells is also the salivary glands.
Okay.
So the saliva production in the mouth goes down, and the mouth doesn't like to be dry for obvious reasons, and this is inflammation.
Okay, let's take a look at the next set of pictures here.
And this is an infection that can be caused as a side effect from radiation and chemotherapy, that as the gums are dry, the bacteria that are naturally occurring in the mouth can actually infiltrate and just basically play havoc with the oral cavity as well.
Okay, what else do we have? We've got about 3 minutes in the show here, so
yeah. And then the most important thing that we see as dentists is that the lack of saliva causes a lot of dry mouth, and the side effect of that is cavities.
Yeah.
And that can cause dental infection as well. And this is very, very critical to get on top of even before therapy starts, you know, to be positive about things, not just negative, is that now that we know that these things occur and patients are at high risk, we are involved in a lot of pre-planning.
Yes, which is great.
Which is great. And then the pain is less, the nutrition is better because then you can still eat, because there's nausea associated with therapy.
Right.
And you need to keep up your nutrients. You need to be able to eat food without pain in the mouth, and then you can fight and heal better as well.
Absolutely. And then was there one other?
Yes,
there we go.
and this is actually a blue laser that is on the market in the last few years. And what it actually does is you radiate this in the mouth, and your abnormal cells look dark, but natural cells fluoresce. So you can actually have a lot of diagnosis early on, and a lot of dentists carry this in the office.
Okay, that's awesome. That's
a
an
screening
option.
thing.
So you
Yeah.
can help sort of treat in a way that is going to help as early as possible.
Absolutely, and this is a part of our natural examination every time we have a new patient or on recall. And so things always change, so we always have it available.
Yeah.
You know, you have to be on top of it.
You do. Yeah. This is great to know. Again, a lot of people that undergo cancer treatment, this is a beautiful option for them to be able to be diagnosed ahead of time and know what the situation is. So really appreciate you being here today.
Pleasure again.
Always a pleasure to have you. Information on the screen if you'd like to get a hold of Dr. Desai. That is her website and her phone number, 778-471-6001.